Hi everyone, I'm Jean Ketcham, CEO of Aging But Dangerous, and I have with me today Dr. Brost from the Brost Clinic in Wayzata, Minnesota. And I want to talk today about knee pain. And I do have trouble with my knees, but as everyone knows, if they've been watching this, that I've been coming to you for quite a few years, so I don't have as much as I would have had if I hadn't been coming to a chiropractor. But the knees, it seems like people are having a lot of knee replacements. I have two friends right now that are having knee replacements. So talk to us a little bit about the knees.
Well, knees are obviously very important because we can't walk without knees, and walking and being able to exercise is important, as it is important, especially as we're aging, when we have more time, we can travel and so on, and if you have bad knees, you can't walk on cobblestones in Rome, for example. So you want to maintain your knees to keep the mobility and be able to do the things that you want to do. Knee pain is often misunderstood because if you go to most regular medical practitioners or orthopedists, if you have knee pain, they're going to zero in on your knees and look at your knees and then take some x-rays, sometimes an MRI, and that can obviously reveal things if you have arthritis and such. But a lot of times, the reason why people develop knee pain is not because there's something wrong with the knees to start out with. It's because the hips are off level. So if your hips are out of alignment and you walk around with your hips and put a lot more weight on one knee day in and day out, that knee down there is not going to be happy. So when we have patients with knee pain, we don't just look at the knee, we look at the whole body. We look at where the hips are at, if there's undue pressure on the knees. We also look at the feet, because if your arches of your feet are lower on one side than the other, then that's also going to bring that knee down and create more pressure on the inside of the knee. So it's really important to look at the person as a whole and not just zero in on the knee. Obviously, we look at the knees themselves too, but many knee issues can be solved by looking at the hips and the feet. Yeah.
There again, if we can go get it done by chiropractic care, then we maybe wouldn't have to have an operation. But you just mentioned something, and I wanted to ask you about this, about arthritis. In chiropractic care, does that help arthritis?
Yeah, there are many different types of arthritis. We have like rheumatoid arthritis, which is a systemic inflammation, an autoimmune problem, which a lot of chiropractors that work also with nutrition can help solve. But the more common problems, especially with knees or hips, are osteoarthritis, which is a wear and tear type of arthritis that happens because of something not being quite in the right alignment or having undue pressure on it for many years of being stressed. So by getting things into a better alignment and taking that stress off the joints, we can actually stop the process of degenerative or osteoarthritis and get the joint moving better and get rid of some pain.
See, you all, we are learning so much about this, about how to take care of our bodies and what we can do without taking a bunch of medication or putting a lot of bad things into our bodies. I think it's very, very exciting. And of course, this is one thing that Aging But Dangerous is all about, is to keep you informed and to do education on how we can grow old and still be happy and get around, and like you said, walk the cobblestones in Rome. Yeah. I love that. So stay tuned. Hi everyone, I'm Jean Ketcham, CEO of Aging But Dangerous, and I have Dr. Brost with me today. She has been giving us lots of information on chiropractic care, and I wanted to ask you, can you tell us how people can find a good chiropractor where they live?
Yeah, it's I often get asked that question because I have patients that have relatives in other towns or other states, and they said, how can they find a good chiropractor? And I always say that ask your friends who they see. The best way is to get a recommendation, because it's often a word of mouth thing, and if your friends like this particular chiropractor, it's probably a pretty good bet, especially if you ask several people and the same name comes up.
Yes.
In today's world, we used to all look in the phone book and look at the ads and whatever, but you can't really do that. You can Google, chiropractor in your area. looking at reviews, Google reviews, 5-star reviews. If you
that's a good idea.
Yeah, if you find somebody that has a lot of 5-star reviews, that's probably a good bet. And I usually tell people just to call and say that I want to make an appointment for a consultation. Go in and meet the chiropractor and see if you feel comfortable with them. One thing that you want to check too, because there's all chiropractors have good education, where we all have 4 years postgraduate education after pre-med in college. So everybody has a solid education background. But because of the HMO influence over the healthcare, there's been a lot of chiropractors that have really cut back on the services that they used to provide simply because they're not getting paid for it in the HMO services. So a lot of chiropractors nowadays don't have x-ray available anymore because, and they sometimes send out people for x-rays. But to me, I think x-rays are so important because when I work on a patient, I want to see what's in there, especially if it's a spine that's a little older. There might be degenerative changes and so on that we want to make sure. So I would suggest asking if they take x-rays or if they have x-rays available. A lot of chiropractors also have further education on top of their 4-year chiropractic degree. Like I have a 3-year degree in neurology also on top of the chiropractic.
I didn't know that.
Oh, see, okay. You learned something new. Wow. So I deal often with more complex or complicated cases. I also have a certification in acupuncture, so we often combine acupuncture and chiropractic. So, this often if you go in on people's websites or chiropractors' websites, you can see the different
the education.
And the different services that are available. You can, depending on if you're more comfortable with a female or male chiropractor, about 50% of all chiropractors nowadays are female, so a lot of times people are more comfortable with that. But there's a lot of good male chiropractors out there too. So just ask your friends who they see and
that is great information. That is great information. So, okay, how do I close this?
If you're in Minnesota, or if you're in the Twin Cities area, the Brost Clinic.
Yeah. If you are in the Twin Cities, then the Brost Clinic in Wayzata, Minnesota, is the one to go to. It's Dr. Brost. Like she said, I didn't know you had the neurologist or neurology.
Yeah, and also there's 5 chiropractors in our clinic, so we're also a bigger clinic, so we have more resources available than a lot of clinics.
Right.
Yeah.
So, all right, everybody, take the notes and go find yourself some chiropractic care. Oh Lord, I can't ever close out.
It's good. That was almost 4
We're having
minutes.
way too much fun.
We are having too much fun.
Yeah.
Did my wig separate?
I'll be ready.
All right, whenever you're ready.
Hi everyone, I'm Jean Ketcham, CEO of Aging But Dangerous, and I have here with me again Dr. Brost from the Brost Clinic in Wayzata, Minnesota. She happens to be one of my favorite people in the whole world because she's helping me age very gracefully. I'm able to move around and do all kinds of things. But we're going to talk today about headaches and neck pain. Now, I want to ask you, these pillows that they advertise, and I won't say the names, but a big one here in Minnesota, does that really help neck pain, or is that just kind of an advertising? Well, we won't say whether it's, but does a pillow, any kind of a pillow, help your neck pain or help you with a headache?
It definitely can help with neck pain for people that have a chronic neck issue. If you sleep on the wrong pillow, that can really worsen the condition.
Oh, okay.
The pillow that you're talking about that we all see advertised on TV is really good for people that are side sleepers. I've had a lot of my patients come back and really like it. So
yeah, I have one and I sleep on my side, but
so
I just always wonder if it's hype or if it's...
If you have certain neck conditions, though, for example, if you've been in a car accident or have a history of having been in a car accident where often the normal curve in the neck is decreased and creates pressure and tension in there, then one of the support pillows where you sleep on your back that has a little arch support under your neck is better. But the main thing with neck pain is to figure out why there is
Why
pain
it's
there.
there.
It's usually because there's something a little out of alignment in the neck that's pinching or irritating a nerve, which makes all the muscles tense up in the area. And it can also create headaches if there's the pressure on the nerve is in the upper neck, because all the nerves from the upper neck go up to your head. So if there's nerve pressure there, that's where about 95% of all headaches come from. So with chiropractic care, we can figure out where that pressure is and get rid of that, so people don't constantly have to take pain pills for headaches. It's such a people take tons of literally tons of medications every year for headaches.
And I'm one of those people that will just have the headache and I will just live with it before. But I have to ask you this question. So we moved to this very tiny apartment and in downtown Minneapolis, and we had to put our big TV in our bedroom, which we've never had a TV in the bedroom before. So I will sit in the bed with these pillows and watch TV, and oh my gosh, it hurts my neck so much. Is there anything I can do? I mean, what about one of those chairs or what? I don't know what to do about that, but it sure hurts my neck.
Well, you're clearly going to have to move to a bigger apartment now.
I know.
No, but the position of the head, like if you sit in bed in a kind of a quirky position or push your head forward, that can be really painful. And also things like computers are such a common thing nowadays. People sit on a computer like this and type all day long, or use a little mouse, and it just tenses all the muscles up there attached to the neck, and people end up with neck pain and headaches from that. So those everyday things that we do, pillows and work positions, ergonomics, are really important. But the best treatments for neck pain and headaches is definitely gentle chiropractic care.
Because is it true again? Because I know you've said that several times, just to keep that blood flowing in there and keep everything loose and the.
Keep the joints moving, keep the
tight.
pressure off the nerves, and keep everything functioning the way it's intended to.
Okay, all right. Thank you, Dr. Brost.